What is extreme avoidance in contamination OCD? Extreme avoidance in contamination obsessive-compulsive disorder refers to the intense efforts made by individuals to avoid anything they believe could be contaminated. This behavior is a compulsion aimed at reducing the anxiety caused by obsessive fears related to germs, dirt, viruses, or other contaminants. Unlike typical caution or hygiene practices, this avoidance can severely disrupt daily life. In contamination OCD, people experience persistent and intrusive thoughts about contamination. These thoughts can include fears of exposure to harmful germs, bodily fluids, or unclean environments. To cope with the distress from these obsessions, individuals often engage in compulsive behaviors, which can include extreme avoidance. For instance, someone with this condition might avoid public places like restrooms, public transportation, or crowded areas to minimize contact with perceived contaminants. They may refuse to touch objects, surfaces, or even people they believe are contaminated. This can include avoiding door handles, shaking hands, or using shared utensils. Social interactions may also be avoided entirely to prevent any risk of contamination. Additionally, individuals may discard or isolate items they think are contaminated, sometimes doing this repeatedly. They might steer clear of situations that could trigger their contamination fears, including certain foods, clothing, or even news about disease outbreaks. This avoidance is not just a preference. It is a compulsive behavior driven by intense anxiety and fear. While it may provide temporary relief from distress, it often reinforces obsessive fears, maintaining the cycle of OCD. The avoidance can become so extreme that it limits a person's ability to work, socialize, or perform everyday tasks. Extreme avoidance in contamination OCD is part of a broader pattern of obsessions and compulsions characteristic of this subtype. It is crucial to understand that these behaviors are symptoms of a medical condition rather than voluntary choices. Effective treatment often involves cognitive behavioral therapy, particularly exposure and response prevention. This approach gradually helps individuals reduce avoidance and anxiety by safely confronting feared contaminants under professional guidance. In summary, extreme avoidance in contamination OCD is a compulsive effort to evade perceived contaminants, significantly impairing daily life and perpetuating the cycle of fear and compulsive behavior.